ready? You got me running, you got me running, got me running.
I am Meredith Hirsh, and this is Working Healthcare. I just interviewed someone tackling a problem we don't talk about enough: the allied health staffing shortage. We're always hearing about the physician shortage, but what about the people who keep the system running? The medical assistants, pharmacy techs, lab and imaging teams, rehab therapists, dental assistants, and EMTs, just to name a few. I'm living this in real time. I always have roles open. In fact, this morning, I got an email that one of our infusion nurses quit. So if you're looking for a position, give us a call. Now, imagine this. What if you always had a pool of trained candidates ready to go? That's what it looks like when you become a training site or sponsor training. My guest is Ton-Quinlivan, founder and CEO of Futuro Health. We talked about how her background led her to launch this innovative nonprofit and how this model could help solve your staffing shortages. Ton-Quinlivan, welcome to Working Healthcare.
Delighted to be here, Meredith.
I'm thrilled that you're here because this is such a hot topic. I had a recent podcast episode where we talked about APPs. So the shortage of nurse practitioners, the shortage of physician assistants. We know that there's a shortage of physicians, but we never talk about the shortage of all of the support staff, which we refer to as allied health professionals. So you're here to talk about that and how you are solving the problem. But before we get into it, you have a really strong business background and a strong background in workforce development. But now you're in the educational sector focused on healthcare. You've been in education in the past, but focused primarily in healthcare. How did your background prepare you for this role for the company that launched in January of 2020?
Well, Meredith, thank you for the question. My expertise is in workforce development. That came from the private sector, the public sector, and now the nonprofit sector as CEO of Futuro Health. Back when I was in the private sector, I actually took my company of 20,000 men and women to having no opinion in workforce development to actually becoming a nationally recognized industry best practice. And then I was appointed by the governor of our state to become executive vice chancellor of the largest system of higher education, which is the California Community Colleges. And there I drove the workforce mission, growing workforce programs from 100 million to 200 to 700 to over $1 billion in public investment. And so when I stepped off after serving 2 terms under the governor, I needed a moment to get the bounce back into my step. But then I was approached by Kaiser Permanente and its partners, who came to me and they said, for 2 years now, we've been wrestling with this segment of our workforce called the allied health workforce. And that's 65% of the workforce that we all need in our backyard. And they said, we have a lot of concepts, but what would it take for you to be CEO and apply some of the best practices that you've acquired along your journey to really help us tackle the critical shortages in healthcare? And they were very interested in seeding solutions that not only help themselves, but help the industry in general. As you know, the workforce tends to be very competitive in healthcare. And I have to say, Meredith, I had to take a pause there because I had just come from running $1 billion system, and to go and found a startup felt very risky.
But
what
you
if I
have,
couldn't figure out the solution?
and you have such a strong background, though. You have your educational resume is phenomenal. Your undergrad, Georgetown. You have 2 master's degrees from Stanford. You have an honorary doctorate. So you obviously have the educational background. And the reason why I share that is because I think it's really important for listeners as part of working healthcare to know certain professions in which that formal education is necessary and some that aren't, right? But you are in the educational sector and you're helping those who may only have a high school diploma, right? And so describe all of the different positions within the allied health professional umbrella.
Absolutely. And maybe if I could just finish a story. When I looked at the opportunity presented to me, I had to have a moment of reflection. I said, why would I take on something that feels so career risky like this? And it took me reaching back into my background as first generation, where education and the doors of education was open to me when my family came out of the war and came to the United States. And so I do feel like the last role that I had with the California community colleges and this role with Futura Health, it's all about paying it forward and unlocking opportunities for others. And so you're absolutely right. 65% of the workforce, the healthcare workforce, are these allied roles, and much less attention have been paid to them. And the way I describe the allied health roles, for example, if you were to leave the house, and hopefully this doesn't happen to your listeners, but they got into a car accident, it's the emergency medical technician that arrives on the scene. It's the medical assistant that checks you in. It's the X-ray techs or the person that does your blood draw, the phlebotomist. There's a whole world of technician level where they can access the job with more than a high school degree, but less than a bachelor's, for example. So from mental and behavioral health, from the allied health and oral health, there's such a range of occupations that become much more important, especially as we foresee the shortage in doctors. And so these allied roles are going to have to be better leveraged in the future of care.
And I did some research ahead of time because I really wanted to understand the deficit of these allied health professional positions. I know in our medical practice, probably, and I shared this with you, besides hiring a rheumatologist, I can hire a PA and a nurse practitioner easier than I can find a radiology technologist. And that's an RT with a 2-year degree. It is so difficult, and I'm not alone because I'm fighting with the hospitals to try to get them. I'm also fighting with private practices to try to get them. Then they have mobile imaging centers and they have standalone centers, and there's definitely a shortage of these positions. The American Hospital Association actually predicted that 3.2 million healthcare workers, there would be a critical shortage of 3.2 million healthcare workers by 2026. Now that we're in 2026, I was like, are we there? Did we actually reach that shortage? So you starting this in 2020 was perfect timing. The federal labor data actually shows that there are currently 1.34 million job openings in healthcare and social assistance. And to me, that's staggering, but it really does support the fact that we always have positions open within our clinic. So we're always looking. Share with me how somebody gets this type of training to be an allied healthcare professional, because I do want to lead into Futuro Health, which is the company in which you founded. But how does somebody even know that these opportunities exist?
Well, you're right. It doesn't roll off the tongue, over the dinner table, right? Mm-hmm. Your parents may be talking about, hey, you becoming a nurse or a doctor, but rarely do they talk about, well, let's think about you becoming a medical sonographer, right? Mm-hmm. It's really not the conversation over the dinner table. And so we do have to put some attention and spotlight into these important and critical roles. 85% of facilities right now report that they have a shortage in these healthcare workers. And even with all the chaos that is happening right now with federal funding, we all know that the demographics are here and can't be averted, and which is the aging of the U.S. population, right? With the doubling of the U.S. The population over 65, not only will we need more care, but we need more caregivers. And there's just not enough working adults to go around for those roles, in addition to the teachers and the bakers and, the Uber drivers that we all need. So it's a real challenge that it's good that we got started in 2020 to begin to be a solution for the industry. And sort of fast forward, we've been acknowledged by the World Health Organization, CMS on its Innovation Day. Our scholars were featured in BBC just this year. So we're really proud of the work that we're doing to show really the art of the possible. So in terms of growing your own healthcare workforce rather than leaving it up to chance. So, Meredith, the normal behavior of all of us as employers is let's just transact. Like if we post and they come, great. We don't have to think much more about it. And admittedly, workforce development takes more effort, right? But if you're getting to the situation that you just talked about, where you're posting and you're praying and hoping, then perhaps it's time to focus on doing some intentional workforce development and growing your own. So we find that, there are many, many adults. And the reason why I talk about adults is that it's not enough if you've begun a strategy working with high school. That population is actually shrinking or flatlining throughout the country. So it's good, but not enough. And so part of the action is trying to figure out how to bring adults who may be interested in being of service to their communities, bringing them into the credentials so that they can be on your doorstep, and then move up within your organization, which is really important for retention. So our process is looking at all the barriers that are in the way of when people have complicated lives, and then simplifying the education journey for them, adding supports, and then removing the debt component so that they can come out with their credentials, like in medical assisting or surgical tech, many of the techs, and come out debt-free so that they can work in healthcare now. And let me just give two examples. Like Tamika, she was working as a security guard at a hospital. She's in her 30s. Her mother had cancer. So she began taking care of her mother and realized that maybe she could be a caregiver. Maybe she should go into the direct care. Well, she found our flyer, and today, after that training, she became a phlebotomist. So we got her into direct care today, and she evolved from there. Or Justice, who was laid off during the pandemic, he was working at a ramen noodle shop trying to earn enough money to get onto the nursing pathway. And when his aunt told him about us, he became a medical assistant through us, debt-free, and landed his first and has been promoted since and is continuing to pursue his path of wanting to be a nurse, but he's working as a medical assistant today. So it's in the competition for talent, we're removing the barriers and providing supports so that adults can successfully move into healthcare when they thought that was not possible or viable.
So this started with Kaiser Permanente, and it started in California, and now you're actually in several states, including the District of Columbia. And I'm just trying to have a better understanding of how you enable students to seek out these technical degrees debt-free. Who else is funding and supporting Futuro Health?
Yes, there always has to be somebody who's supporting the scholarship so that the scholar can attend debt-free, right? So we had like Sutter Health. They were using their community benefits dollars, and they said, we'd like to fund 300 medical assistants. Because it's community benefit dollars, they can't all come to us, but we'd like them to come from the backyard of all of our facilities. So that's a very strategic investment there. In Florida and in Connecticut, we had a foundation where the benefactor was very interested in the nursing, the healthcare field, and they have funded 2,000 scholarships so that 2,000 scholars can earn a credential and move into healthcare. So that's the funding part of the equation. We can go and set up wherever there's somebody willing to sponsor the scholarships. The second part to the equation is the education partners. So in California, we have like 17 programs. We have a network across the country now of 43 education partners whom we've curated. We've selected their programs. We've integrated them to simplify the education journey. And so this has been a real value. And what we've asked them to do is upgrade their curriculum, for example, to match what the employers need. And when we go into a new geography, we look at whether or not we have a partner already in that can extend there, or we can source new partners. So education partners is the second part of the equation. And then, of course, the employers themselves and what they need. So, we go in and we introduce ourselves, and then healthcare providers talk to us about what is a priority for them. And they're, of course, very important in terms of providing clinicals.
How do people become an educational partner? For example, our site and our clinic is a partner for internal medicine residency programs. We used to do a medical assisting program. We are currently doing an RT program because, as I shared with you, that certainly is difficult to find a strong RT to join a company. And so this is our pathway to hopefully, when they're finished with schooling, we've offered them such a great experience that they're willing and wanting to join us. How do people seek out Futuro Health to be able to be an educational partner?
Well, first of all, I want to compliment you, because when you have a talent puddle, where competition should occur is not at the beginning of the development of the talent pool, because that's where we should collaborate. And then strategically, if you can, instead of just waiting till the end where you're hiring, which is the greatest competition, moving back a little bit to offer that clinical internship, that's where you have an advantage, because most people who go through a workforce development program are very grateful for that opportunity, and they tend to stay wherever they work at their clinical. So what we need to just hear is, if you are a provider interested in providing clinicals or hiring, please contact us, www.futurohealth.org. So the Futuro is like future, but with an O. And what we do is then set up affiliation agreements with the education partners that have been curated and vetted in our education ecosystem. It's just that simple.
Do the companies or the clinics or the hospitals have to have an existing educational program already in place?
No, not at all.
Okay.
I mean, many organizations don't have the depth of expertise or even the volume of staff to be able to help out. And that's why, we're brought in to augment and help them set up this pipeline.
And so you are in the public sector and you have community partners as well. You have very large community partners. You're working, for example, with CVS Health, with Homebridge, the California Department of Aging. So it's a myriad of opportunities, right? From geriatrics to home health. I know you have hospice organizations. What other opportunities are available to students saying, hey, I've worked in the workforce, because your average age is 29 years old. So you're certainly not getting people just out of high school. I need to switch a career, or this is not a great opportunity for me. I know I can do better. Or now that I'm 30 years old, I've actually figured out what I want to do in life and I need to go back to do it. So are there any areas you're specifically seeking right now? Could it be pediatrics? I don't know if you're working in that realm.
Oh, you know what requests has come into us. So, for example, we have produced thanks to the partnership with our education partners and employers, a lot of medical assistant, which is a bread and butter of healthcare. And so we've been approached to add a kind of round out that individual. So instead of having a generic medical assistant, part of our formula is that we add what we call human touch healthcare, which is a fan favorite both to the scholars and to the employers, where 6 essential skills of healthcare is cultivated and developed. And it's very well tailored to adults. So from teamwork to cultural competence, it's really just bringing out some of those essential skills in healthcare, not with lectures or talking head or PowerPoint, but very experiential. And so it's the result is that 100% of all of our scholars go through that curriculum before they even enter a technical program. And our education partners love it because then the scholars come to them much more committed and more polished and more ready to study. So that's been part of our secret sauce. And then in addition, on the back end, we've had requests to add some specialties. So instead of a generic medical assistant, it's a medical assistant with the specialty to get into pediatrics, for example, or oncology. So adding in a little bit more to help those hard to fill positions.
Your team, when I did this research, has logged, oh my gosh, almost 327,000 two-way learner engagements just in 1 year, just in 2025. Can you share with me the operating model behind that? How long does it take? What does it cost per learner to be able to do that?
Okay, so let's say one of your listeners has an uncle or cousin that is searching around, and so you tell them about Futuro Health. All they need to do is get onto our website, and if we have the scholarships open, they just apply for one of the career options. Within the week, they'll be on the phone call with the success coach who is going to talk them through the opportunity. Is the timing right? Is their family situation ready for them to study? And just start building the accountability and the understanding of what they're going to pursue. Every 2 weeks, we start human touch healthcare. And this is really important for adults. Adults don't really have the patience to wait until the fall or the January to get started. When when they have that desire, they want to start now. So every 2 weeks, we have start dates for human touch healthcare. And then after they finish the 6 weeks of human touch healthcare, it unlocks the technical program.
And how long does the technical program take?
It just depends. Medical assistant programs tend to take between 15 months to 7 months. Some programs are 2 years. Some programs are 3 to 5 months in nature. Like community health worker is a much shorter program. Phlebotomist is a shorter program. And the good news is that they get to attend debt free. They do pay a $150 registration fee to just have a little bit of skin in the game. But we unlock the journey for them as they go through each of the piece part. And we found this very, very successful. And the demographics is that we have 90% ethnic diversity, 48% linguistic diversity, average age 31. So it's really a set of untapped talent that wouldn't normally get into healthcare had we not opened up this path.
How much can somebody expect to earn after going through the program on average? I know you have various different types of positions, but I know that somebody going in is saying, you know what, I want to change around my life, or I'm now a single parent, or there's a way that they want to improve their ability to support their family. What can they look at for an average hourly rate?
These careers, they tend to hover in somewhere between the 30s to the low 50s in terms of kind of annual salary. And what we also find that is we have quite a number of especially women, single moms, and they're able to go from 2 jobs to 1 job and 1 job with benefit. And that's not only life-changing for them, but life-changing for the rest of their family. And we've had situations where it's the mother is able to get into a job, and then their usually their daughter is able to also pursue nursing. So you end up with two persons going into healthcare instead of one.
How do you coach students or those interested in going into an allied health profession to go and become a pharmacy tech or versus an x-ray tech or versus a medical assistant? What type of coaching do you offer so that people don't get stuck potentially training for a myriad of time and then get into this trap of a low wage?
Yeah. The way that we view it is it's the first step into healthcare, right? And there will be much more investment from the provider in growing their career if they're good about retaining workers. So the first decision for these learners, adult learners, is really about whether they're willing to work with blood and other bodily fluid. That determines which set of careers would be more attractive. And then people also, especially adults with complicated lives, they tend to look at time. What is the time window that it takes for me to finish? And so that's a big consideration for adults. And then what we also do is success coaching. So in addition to the human touch healthcare, removing the barrier of tuition, we do a lot of success coaching and to cheer them on, especially doing the tough parts of the curriculum so that they know that they can make it to the end. And so even as we work across 43 education institutions, we average about 83% completion rate of these credentials, which is astounding, given the population we work with. And also think about, for many providers, you already have people maybe working at the front desk or, behind the scenes. They already appreciate you in terms of the culture and the fit and the commute, and they're willing to do that. And so is there a way to grow them in place so that you have options and don't have to go outside? So always think about, how do you move them up? And then there are strategies to move to create the talent pool that come day one ready.
Do you have a reimbursement program if somebody does not finish the program? So 83% is remarkable, but what about the 17% that don't and go through half of it, right? It's like, is it a sunk cost, or actually can you recoup some type of payment?
Oh, we've thought about it, but fortunately for a nonprofit mission, we're able to make that investment. And one of the things that protect, for those that are thinking about providing scholarships in order to and sponsoring scholarships in their area, our Human Touch Healthcare program is actually a protection for your investment before an individual goes into the high cost, much higher cost technical program, right? Because a large part of adult ability to complete a program is all about getting their family in order so that they can study, right? And so if they go from directly into the technical program, for many adults, that 0 to 60 is too fast. And so we're working with them just to reorganize their family situation so they can learn.
You're currently in 9 states and DC, as we discussed. What are your plans to expand to other states throughout the U.S.?
Well, we can go wherever we're invited, and so right now, we want to put the call to action out there. If you're a rural network, what we do, our solution is particularly well suited for the complicated terrain of rural, and large providers. Health plans, interestingly enough, have been coming to us because they want to help solve some of the workforce constraints faced by their providers. And so, in a way, it's like the more complicated your workforce situation at the allied health level, the better match for us.
And we talked about and we talked about the World Health Organization. It definitely has an interest in the Futuro's model. What do you think they see? Is this something they want to replicate in other countries, or what are they looking at?
Well, this issue of the aging population and the need for caregivers, there's the same phenomenon happening between richer country and poorer countries, where poorer countries are creating the workers and then exporting them to the richer countries. And so you're having shortages in the aging richer countries. And that's exactly the same phenomenon that is also happening here in the United States. I chaired the California Healthcare Workforce Education and Training Council, looking at all of our shortages. And whether it's physicians or dentists or mental or behavioral health or allied health, one thing we do see is that whereas the workers from underserved community are willing to commute to the wealthier community, the commute pattern doesn't go the other way around. Mm-hmm. So when we think about health care, health equity, we do know that we have to grow from communities to serve communities. And we all have to do our proportional share to grow our own healthcare workers, especially the allied health.
And you grew up in a family of those who gave back to their communities. I know you're from Vietnam. You came over during the Vietnam War when you were very, very young. And your dad is a doctor. Your mom is a teacher or was a teacher in Vietnam. How did that impact your desire to either go into this now healthcare sector of education?
My dad was a neurosurgeon in Vietnam, and when we came and escaped from the war and came here, he had to start his residency from scratch. Mm-hmm. You can imagine how painful that process was. And my mother was a teacher who, that's a very well-respected position in Vietnam, and of course she had to start from scratch and became a bookkeeper. But I never found them to be, and you could easily find yourself to be bitter of the things you lost, but they were always so grateful for the opportunity to start over here in the United States. And so I think I carry that value to pay forward the opportunity that my family and I had. And I find that when I work on the issues of unlocking opportunity for others, and this is usually found in the education area or workforce area, it unlocks my own superpowers, right? I can become fierce, and I can redesign the systems and carry legislation and build coalitions of unusual allies. And so I'm glad to be bringing some of these best practices over to Fedora Health to be of help to this sector.
I love that inner drive and all of the passion that you have, because I definitely think it stems from nurture in nature, right? Who you are, your upbringing, what you see, what you saw your parents do to continue to work and support their profession and their family as they move to another country. So very commendable. I want to wrap up and ask you the same question that I ask every working healthcare guest. If you could create one change within our American healthcare system, what would that be?
Knowing that the aging of America is here and will be at the center of the future of care, I think we need to put together and bring together all the best minds to think how else we can solve the caregiving situation for all of our communities.
I think that's a really great, thoughtful response. I've always said that we don't need the people on Capitol Hill to do it. We actually need the people who are in the trenches and working and understand that. So I really appreciate that response.
We need to break out of our silos in order to solve big issues like these. So let's think about how the education sector, healthcare sector can work together to serve the same zip codes, for example, the same underserved zip code. Inherently, workforce development is a team sport, not an individual sport. And so employers and providers don't need to go at it alone.
Yes. And Ton-Quinlivan, thank you for joining me on Working Healthcare. If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post about it on social media. Connect with me on LinkedIn to keep the conversation going in between episodes. If you've got a question, an episode idea, or someone you think I should feature, send me a note at meredithhirsh.com. Thank you all for the 5-star reviews. They help more listeners find the show. New episodes drop every Tuesday. Subscribe so you don't miss what's next. Tune in weekly as we explore the inner workings of healthcare, because you can't fix what you don't understand.